All right. Hi, everyone. I am Dr. Maxwell, and my role here at UNC Asheville is as the pre-health professions coordinator, and I also teach. We also have here today Herman Holt. He is Dean of Natural Sciences, and he is a organic chemist and also, again, on the pre-health committee. Right. Still trying to figure out how to, I'm good at Zoom, but not at recording. Okay, so hopefully this recording is going to go okay. The goal of this session is to give you an overview of the medical, dental, and vet school application and letters of recommendation, specifically the committee letter of recommendation. This presentation is really it's going to be helpful for students who are first and second years, but I think that it's because it's good for y'all to know and to be planning ahead, but it's also going to be very useful for students who are in their third or fourth/senior year in school and looking at applying to one of these schools. The reason I grouped these together is we're going to see in a second is because of either the tests that you go through or the application or the committee letter of recommendation. And again, if you have a question, just put it in the chat and Aaliyah is going to manage that. And my goal is just to go through this and then make this PowerPoint available to you so that you can have access to the resources as well. All right, so I'm sorry, I'm going to try to just do the whole screen. All right, so again, the overview of this, specifically, we're going to look at the MCAT, which is the medical school, medical college application test, and the DAT, which is the dental application test, and how to prepare for it. We're going to get an overview of the application, and then we're going to talk about letters of recommendation, like who might be, how you go about asking for those, and then what is this committee letter of recommendation. And that is something that is specific for medical and dental applicants from UNC Asheville. Okay, so the graduate school admissions exam. This is a test that all these tests evaluate your knowledge and compare you to students across the country. So if you go to one school, you might, your GPA might be A's and B's, but if you went to another school, it might be B's and C's, but maybe you learn just as much, or maybe or vice versa. So these tests are, they kind of level the playing field for everyone so that schools can evaluate you based on someone who's in Idaho or California or New York. The medical students who want to apply to an MD or DO program take the MCAT. Dental students who apply to a program for a DSS, I'm forgetting now what that stands for, or a DDM, it's basically the same. It's a doctorate of something surgery, and then a doctorate of dental medicine. It's effectively the same as far as everything that I've read. They take the DAT. It's very similar in content, except the DAT has some perceptual ability because dentists are constantly working with their hands in a small space. And so they want to know that you have good eye-hand coordination. And then a veterinarian or DMV, they can take the MCAT or the GRE. I am not really going to talk about the GRE in this presentation. I'm going to focus on the MCAT and DAT when talking about the grad school admission exams. So for the MCAT and DAT preparation, the first thing you want to do is complete the recommended coursework. These tests are really evaluating your knowledge of 200, 300, and 400 level biology and science courses, as well as we'll see some more details. If you've advised with me, you've seen one of these. This is hyperlinked to where you, the page that has access, and I can show y'all that in a minute. But basically, I worked with students to try to, and I know it's small and I apologize. I color coded it so chemistry is in this pale yellow, biology classes are in this pink, or health and wellness in orange, physics, neuroscience, psych and sociology, and then math courses that some schools may require. The goal here is to come up with a plan that is realistic, where you put the courses in different semesters and don't pile them all up in one semester. You get you have to take Gen Chem before you can take organic. You have to take Gen Chem before you can take the cell and molecular biology. And so it helps you plan out your semesters and make sure they're fairly balanced, because this is a marathon. It's not a sprint, and so it's good to approach it that way. Also on this, you'll notice that if you can see down here, this dark green, it says start grad school. So one thing to keep in mind, the standard of this is 4 years, and the student graduates in 4 years, and then they want to start grad school right after graduation. They need to apply to that grad school the summer before. And in order to have a complete application, that application includes a graduate admission test. And so they may take it at the beginning of the summer, or they may take it in the spring semester. But before taking that graduate school admission test, they need to take all the courses that are going to prepare them for it. So that's why I like to backfill this with students so that we can plan appropriately. All right, so how do you prepare for the MCAT and the DAT, or the DAT? I think most people say DAT because that sounds funny. All right, so again, complete the recommended coursework. From hearing from current students, from students that have graduated and been accepted to medical schools and dental schools, they tell us that the best preparation, regardless of what the school says you have to have, the best preparation to do well on these tests, it includes 5 semesters of chemistry. So that's 2 semesters of general chemistry, inorganic chemistry, one of each, 2 semesters of organic, and a semester of biochemistry. It also includes biology, 3 semesters of the 300 and 400 level. And so biology has a 100 level course, cell and molecular, that you have to take, but then taking 3 or more of these upper level biology courses is going to better prepare you for this really challenging exam. So the highest recommended courses within all those biology courses that are, for example, included on this list, the highest yield ones are mammalian physiology and cell biology. I will go back real quick and say that if someone wanted to take anatomy and physiology in health wellness promotion, that will also prepare them and replace this. But the difference is that the health wellness promotion course is a 200 level. The biology is a 300 level. So it's going to be more rigorous, as it should be if it's got a higher number. And the mammalian physiology in the biology department is a course that is based on a prerequisite where you have really studied the cell. And so you're looking more at a kind of a detailed view of mammalian physiology from the cellular point of view, as opposed to health and wellness, where you don't have that same cellular study as a prerequisite. And so it may be more of an overview. So it's just something to keep in mind. You need to have 2 semesters of physics. It doesn't matter if you do the intro or the calc base. The intro physics is what is tested on the MCAT and the DAT. They don't expect you to have calculus unless the school specifically tells you we want you to have Calc 1 or Calc 2. And in some cases, some DAT programs, I think, maybe potentially more likely to do that, because they really, your whole job is about looking in the 3 dimension and the 3rd dimension at someone's mouth and assessing it, and working with a 3-dimensional space, and calculus could potentially support that a little bit better. So it's important to look at your schools. 1 semester of psychology, and then 1 semester of sociology. And then lastly, we recommend, and students have told us that 1 or more semesters of neuroscience is the most beneficial. I tell students that if we had a pre-med major on campus or minor, it would be the neuroscience, because the first semester, you're getting an introduction to neuroscience. You're learning about the brain and nerves. Nerves are a specialized cell in the body. They're the only cells that can carry an action potential or an electrical current along their membrane. And so they're a unique cell. And if the neuroscience minor has a 4-hour intro class and then a 1-hour senior seminar, and then mammalian physiology, cellular biology, some of these chemistry classes also fulfill the requirements for that minor. So if you were to take the intro class, you just add one more class, 1 more hour of neuro senior seminar, and you've got a minor. Okay, so how do you prepare for the MCAT and the DAT? Okay, so wait, the first one is complete the recommended coursework, so like get that plan going. Learn about the test and how it's scored. I've got a link here for some MCAT resources and some DAT resources. And just to save us time and leave questions for the end, I'm going to wait on describing that. These learning about the test, like how long is it? What's on the test? How are the sections broken up? How is it scored? That they have weird scoring systems. The MCAT is from, I believe, 473 to 528. And the average across the country is 500. The DAT is from 1 to 30, and the average across the country is 19. Now, for both of these tests, the people who actually get into medical school or get into dental school have the average of what we call matriculants, people who actually started at those schools, is above the national average. So you want to be in that category. So the more you know about the test, the better you're going to be, the more prepared you're going to be. You want to schedule your official exam at least 60 to 90 days beforehand. These things, the exam dates are specific. They fill up. I know this past year, COVID changed there was a whole new standard with so many different things with COVID, but and exam days got canceled and then reopened, but students, it was really challenging in one part because students had to potentially schedule their exam. They had been planning to take it, say, at the end of June, which is a little bit late. I'm trying to push y'all to take it earlier, but say a student decided, no, end of June is the right time for me. And then they decide to go on there maybe 40 days before the exam, and all the dates are filled. So go ahead and come up with links here that y'all can look at later. Come up with a study plan, and when you make your study plan, evaluate when is the best time for you to take the test. So what's on your study plan? The first thing you want to do is take a full-length practice test to evaluate where you stand. How are you doing? Where are you weak? Where are you strong? And I have in bold the full length practice test because these tests are 6 hours long. And if you just take a section, you haven't truly tested your stamina to be able to sit there. It's like if you're going to run a marathon and you just go out a marathon 26.2 miles or whatever, and you just go out and run 5 miles a day, you're not ready for the marathon. You have not actually trained appropriately. So you take that first test, you're going to be exhausted. You're going to be like, oh my God, this was so hard. And I had no idea what was going on at the end. I was just answering stuff. I could barely even read anymore. And you're probably not going to do that well. And that's okay, because it's just giving you a starting point. And you're going to study a lot. And then after you study, you're going to study a chunk of time. There are recommendations out there for scaffolding it, but basically you're going to study, and then you're going to take another full-length practice test and evaluate where you're weak. Maybe for me, I really enjoyed the biology stuff, so I could sit and study biology all the time, and then I would get to the physics and I'd be like, oh, this is hard for me, and so I'd go back to biology. Well, guess which score was low for me? So what that told me So I need to go and I need to study physics. After you take that second practice test, you're going to study some more. I put less exclamation points here on purpose because you're not going to study quite as much. You're studying between practice tests is going to start getting shorter because you're training for that marathon. So you'll take another practice test. You'll study. You'll take another full-length practice test. I know it's redundant. You're going to keep going through this cycle. And as you get closer to the official exam date, the time you spend studying and reviewing material is going to get a little bit shorter because you're going to be spending a day taking a practice test, just like it's the real thing, and then maybe a day reviewing your scores, maybe looking over a little bit of information that you were weak on specifically to that exam, or how were you able to narrow many of your questions down to the two best answers, but then you chose the wrong one, that kind of stuff. Then you're going to study for, maybe a couple more days and then take another practice test. And again, as you get closer to the official test date, you start to decrease the amount of time you study and increase your time taking full-length practice tests. And I don't think I put it in here, but the students who do best on these exams spend at least 250 hours studying. And so that's a chunk of time, 250 hours studying. And then separately, they take at least usually 9 to 14 practice tests. On exam day, the night before the official exam, you know what? This exam is testing you on years of knowledge and months of practice. It is just time for you to have a good meal and get plenty of sleep. And on the day of the official exam, eat a good breakfast, take a deep breath, and then pace yourself. It's a marathon. So the best thing you can do at that point is not stress, it is what it is. If it's meant to be, it'll happen. Now I'd like to transition and talk about what are the components of a complete medical school application. And for this presentation, I focused more on the MD and DO programs. We tend to have more students who apply to those two programs. And I also didn't have enough time to do a thorough enough search and get information for vet and dental. So I apologize to you other folks, but I will enhance this PowerPoint with more information. Okay, so both of these applications are separate, but very similar. Let me back up. What is the difference between an MD and a DO program? There's a little bit of difference in the content that is covered. They're both programs, when you come out, you're a doctor. You are practicing medicine. You have the different initials at the end of your name, MD versus DO. You still, both of them are 4 years long. You, when you graduate, you enter a residency for your specialty that you want to go into. And when you complete your residency, you are out and you are working. DOs can do everything that an MD can do, but along the way, they have to take the boards for the MD residency program. So that's a little bit more challenging in a sense, because that means DOs are taking the exams they have to do for their DO license, but also to be able to apply to the MD programs. Some other nuances about it, DO programs are newer. A lot of people say DO programs are more holistic. Now, I personally take I won't say offense, but I had a little bit of an issue with that because I felt like I was a very holistic physician. I am an MD. I went to Chapel Hill Medical School. I went into a family medicine residency in a rural area because for me, it was all about being holistic. It wasn't just about prescribing medicines, which, which is not what all the other ones are about. But DOs also do manual manipulation. There are some links on our website that can help you with more knowledge about it. When you're applying to both programs use an application service. Actually, all four of these, the MD, DO, the vet, and the dental, they use an application service. So this is a company where you You put in all your information, you send your transcripts there, you type in all your different classes that you've taken in your grades, and then that company verifies it. And once it's verified, they send it out to the medical schools or the dental schools or the vet schools that you identified. A complete application includes official transcripts, your background information, your coursework. And this looks like it's a small thing, but it's really not. The amount of time it takes to type in every single class you took and the grade and the hours and make sure you got it right. And it's something to make sure that you are considering the time investment for this application. It's great because you do it once and you can send it to as many schools as you want. But it is a significant time investment. The MD programs let you put in 15 separate work activities. And so in a way, I kind of look at this kind of like, it's kind of like your resume where you get 15 options to put in something that you did and talk about it a little bit. And then 3 of those are considered your most meaningful. And they give you an additional 1,325 characters. They give you a little bit more room where you're going to talk about how that experience was the most meaningful. Maybe it was doing research on campus. Maybe it was working in the vaccine clinics that are going on right now. Maybe it was working as one of the UNCA health ambassadors, or as an RA, or volunteering with a student group. It doesn't, whatever is most meaningful to you. They give you 3 options to expand on that. The DO programs, apparently, this is surprising to me, but it's unlimited. You know, there is such a thing as too much of a good thing. So, you know, you wouldn't want to having say 40 things in there is not necessarily better. It's better to have quality experiences put in, and they give you 600 characters to talk about it. Both applications have personal statements that are the same length. Some students will actually strategize and plan to apply to both programs because they know they want to practice medicine. They like the idea of both programs, and they're kind of playing the field. The personal statement should be tailored. The application should be tailored to the different kinds of programs you're applying to. I mean, like between MD or DO. If you are applying to a DO program and all you talk about is shadowing MDs, they're going to think that you don't really want to be a DO. You just think that you might not get into an MD program. So be thoughtful about that. The next component of a complete medical school application is the letter of evaluation or letter of recommendation. We'll talk about that in a second. And then for MD programs, they actually say they're going to do a social media and internet search on you. DO programs, they don't outright, I didn't find where they outright say it, but you should expect that. If, you know, that I think y'all are pretty aware of that. Now in this world, if you have inappropriate stuff, if you have, you know, slanderous stuff in your social media, that can prevent you from getting a job, that can prevent you from getting accepted into graduate programs, etc. So for the dental and the vet applications, it's pretty much the same thing. This should actually say expect. MD is the only ones that actually said social media and internet search. All right, so I found this on this website, which and then this information may not be entirely up to date, and you can see that I already updated some pieces of it and some of the changes, but I liked it because it gave you, it's a nice little Venn diagram of the differences between the 2 applications. And actually, you know, now since the personal statement, both of them are 503 characters per personal statement. That could go in the middle as well. I liked it because it also put the cost in there. Again, I think this was from maybe 2015. So I didn't check the number of schools, but you can see there's actually a lot more MD schools than DO schools. The cost is relatively similar. And I will say that most students who apply to medical school, MD or DO, will apply to around 12 to 15 schools. If you want to go, it's it's a lot of work to get your application together, and you want to have options, and you might really click with one school and not click with another one. So those are things to consider. All right, when do you start your application? 18 months before you want to start graduate school. The application guides and resources are available year-round online through the organizations. So that gives you all the information that they're going to ask you that's on there. So you can start your application early before the electronic application actually opens. And it opens about a month before you can actually hit send. So you can start, if it's usually the first week in May, you can start typing in your information. And then you hit send in for the medical school for MD programs. They're the ones that open first week of May. You can hit send. Usually it's the first week of June, and then they verify it and send it to the schools after it's verified. And that's usually another month. Keep in mind, it takes a lot more time than you think. I mentioned the coursework going in. That takes a lot of time. The personal statements, you'll write a personal statement and you'll think hopefully you think it's kind of good. And then if you're like me, you step away and you come back and you feel like it needs a lot more work, and then you have other people read it and they give you suggestions. And so just build that time into your plan. And have some people that have some experience review your personal statement. And remember that once you hit submit, your application cannot be changed. So again, when do you submit so that was when do you start your application? When you submit your application, as soon as the application service will let you. Schools are on a rolling admission. That means that they are admitting people as they go. So they could admit someone, and I think usually they don't start actually sending admission letters until probably October. But but applications for some schools are open until October. So if you submit yours in October, it's not going to get verified for at least probably another month. And then they may not actually look at it for another month. And all these slots for that medical school have gone away already because they've been making offers. So you want to be in the front of the pack for that, but also and I'll say this later as well, you want to apply to medical school or dental school or vet school when you're ready. And if you are struggling to get all your stuff done and you're looking at potentially submitting your application in September, then it demonstrates that this semester or this application cycle is one that you're not quite ready for. I'm not saying you wouldn't get in. I'm just saying it's less likely. And medical schools are seeing that too. Like the students who are really ready emotionally, psychologically, they've got their work done. An anecdote. I was going to apply to medical school. I was so stressed out. I was going to submit my stuff. I'd written my personal statement. I did all this stuff. And I was like, you know what? I am not ready. And it was the right decision. I was not ready. I could have hit submit and I waited. And I had another year of experience. And when I submitted it, I was ready. It would be nice to have gotten education started a little earlier, but I don't think, honestly, that I was in the right, personal prepared place to be successful. So again, applications are going to be verified before they go to the chosen schools, and this process can take more than a month. This past summer was odd because of COVID, but some students, actually it took longer than a month. I'm trying to remember, and I think it may have been even 2 months for some students. So COVID messed a lot of things up, but you need to expect that just because you hit send, it's first come, first serve. So if you submit your application 10 seconds after the person next to you, the person next to you is going to have theirs verified before you. And again, applications are considered complete by the medical and dental schools and vet schools when all the components have been submitted. And again, just look at this about all the components. That includes the official transcripts from school. That includes the letters of recommendation or the letters of evaluation. Some schools will not. The thing I left off of this actually is an MCAT score or a DAT score. So the exam test score. Some schools like Chapel Hill has a policy in normal years that they will not look at your application until they have an MCAT score. So even if you hit submit on the first day and the application was verified, they're not going to look at it until they actually get that score. All right. So other support that you have here at the university for a successful application cycle. Okay, so this one's not at the university, but MSARS, the Medical School Admissions Requirements. It is a website. The fee is $36. It gives you a summary of like you can look it up by state, or you can look at a specific school, and you can compare the schools to see what the MCAT scores are, the GPAs, the ratio of in-state students to out-of-state students for matriculants. And matriculants is that's the word what that means is students who started the program. So students apply, students might get accepted, rejected, or waitlisted. And if they actually, then they might commit to the school, but did they actually start at the school? If they started at the school, they are a matriculant. So that's why we use that word. And people will regularly, it's kind of seems odd, but people will apply to schools that take 0 out-of-state residents. And it says it on the school's website, it says it in the MSAR, and people still apply. So don't waste your money. And sometimes we've had students that like, I think it's NYU has free tuition now for medical school, which is fantastic. And that's really appealing. But if you look, their MCAT scores are through the roof. They're much higher than most other schools. And it's because free medical tuition sounds fantastic. So they've got all these people who are applying. So we've had some students that applied to that school, and then they start and after they hit submit for their primary, maybe they get a secondary and they're looking at filling out another secondary application, which is specific to that school. And often there's a fee associated with that. And then they look at the data, the stats for like MCATs and GPAs, and they realize they're not competitive. And so they wasted that initial $40 or whatever. So just be thoughtful about that. You also have at UNCA, the Writing Center. They are here to help you get started, to review, to help you edit, help you shorten your personal statement, all of the above. You can, one of the things they say regularly is that students feel bad about going there because they haven't started their paper for class or whatever, and they're okay with that. They will help you get started. So definitely use them. And then the other thing is the Career Center. They have support for building your resume. And I put that on here because those activities that you're going to add to your application, it's basically like your more detailed resume, or a CV is another way to look at it. They also have interview support, and they can connect you with different jobs and internships. Letters of recommendation. So letters of recommendation are expected for all these schools. The medical and dental schools expect a pre-health committee letter of recommendation if your school has this committee, and we do. Vet schools do not require the committee letter. So for vet school application, and really this is for all students, for all applicants of medical or dental, at least one of your letters should describe the student's engagement in a clinical setting. That's what you're applying to do. You're saying, I want to study this and I want to do it as my career. So they want to know not just how you feel about it and the experience from your point of view, they want it from the point of view of one of your supervisors. And then all applicants should also have a letter that describes their engagement in natural sciences courses. So vet school applicants will look at that. The medical and dental students will get a pre-health committee letter of recommendation. Again, it's required. The way that, so what is this? It is a letter that is written by a primary letter writer, and that person is on the pre-health advisory committee. We have 7 members. Dean Holt and myself are on it. We also, Amanda Wolf in chemistry, Ted Meigs in biology, Jason Wingert in health wellness promotion, and Judy Beck in physics, and Michael Nealon in psychology. Again, it's here for you to access when I share this PowerPoint. The primary letter writer is going to write a letter that describes you and brings in comments or supplemental letters from other people. Now, so if Dean Holt was writing a letter for somebody, he might get a letter from me, a supplemental letter, because I had them in class. Or he might get the letter from me, a supplemental letter from me, because that student volunteered with something that I was involved with, or was in the was active in the student group, the pre-health student group. And so Dean Holt would then take my comment and add it into that pre-health advisory committee letter when describing either the students' engagement in classes or engagement with volunteering, things like that. So for my idea, for the supplemental letters, the extra comments that I'm going to bring into a pre-health letter, the student would provide me with 2 to 3, or I would get 2 to 3 supplemental letters from natural science faculty. That way, if I have 3, I can choose. I may not use all 3, but I can choose the best ones, or I can choose little snippets from it. And we find maybe we might pull out like 3 sentences. We might pull out a little more, a little less, just to really just the best part of it. We like pull the icing off all the cakes. It's important to have at least one non-natural science faculty. So this is humanities, sociology, anthropology, things like that. We want, and these graduate schools want to see that you are not just a totally focused science person, that you are actually able to converse and engage with other important areas of life besides just the natural sciences. It's good to have at least one comment, one supplemental letter from a supervisor. And this might be from work or from volunteering or from a student group. So, maybe Dean Holt says, Dr. Maxwell, I've actually got plenty of letters for the student from natural science faculty. You worked with the student in the student group. Can you write one and from that perspective? And I'd be like, yeah, great. I'll cover that part of the student, because we're really trying to give the big picture of the student from multiple perspectives. And then ideally we would have one healthcare practitioner. And what I advise students, which is the same advice that was given to me, either have just the pre-health letter of recommendation, or what I did research while I was here. And so I had a research letter, I had a healthcare provider letter, and I had a committee letter. The ideal for the committee letter is to be able to comment at least a little bit that the student did work with a practitioner. It may not have a direct quote, but it's nice if we can at least paraphrase something that the healthcare practitioner said, because we are trying to look at the application like you were putting in all the information about you and you're painting yourself in a certain light and trying to show yourself really balanced. The committee letter, we're trying to do the same thing. We're going to be honest, but we're going to show you in the best light possible. And so we want to be able to talk about you from many different perspectives, and including some clinical can be very beneficial. For example, one student he's got a physician who can write a letter, but he's really worked most closely with a PA, but he's applying to an MD program. And I said, you know what, the PA's letter would be perfect for a supplemental letter for us, because it seems maybe weird, but the MD letter standing by itself might be a bit stronger. Resources to help you gain experience, because I know this is a lot. It can feel overwhelming. You've got time to do it. A lot of people will take gap years, which help them mature, help them get more experience. The average age of students who get into medical school or who matriculate is 24. So that means that the majority of students have had 1 to 2 gap years or more. I was 30 when I started, and actually, I thought that was the right thing. That's when I was ready. And it also gave me a lot of experience and hobbies and kind of a light at the end of the tunnel, because when you're in the midst of med school, it can feel overwhelming. And then you go, but you know what? I've got this other stuff. I've done this other stuff. This isn't the only thing that defines me. The UNC Asheville Peace Center for Community Engaged Learning, they are the ones that bring the blood drives to campus. They are looking for volunteers for that. They are engaged with all different organizations on campus and in our community in the greater Asheville area. And they can get you connected with internships or volunteer experiences, things like that. And the UNC Asheville Career Center, again, they have internships. They have access to jobs. They can help you create a resume and a cover letter, so that you can, even if you're looking to volunteer somewhere, especially if you're trying to kind of like cold call, you don't have any connections there, you're just trying to see if it's possible that you could volunteer or shadow somewhere. If you have a cover letter and a resume to give them, that makes them feel a lot more comfortable about like letting you come in and work with their clients or their patients. If you haven't joined the pre-health email list, I encourage you to do so. It helps me to send out specialized emails to you in order to make sure that you have knowledge about a dentist coming, if you're interested in dentistry, or a physician's assistant coming, if you're interested in that, or medical student who, for example, Kristen Willingham, who graduated from here in 2019, is coming on April 13th to talk about her experience and her strategy for the MCAT and the application and what it was like. So I encourage you to do that. And I'm going to stop recording and take questions. So